All right, good evening, everyone, and welcome to ATP Live Monday. I'm just going to share the video links first as we wait for the others to join us. Okay. All right. Good evening. Welcome to ATP Live Monday. I'm just trying to share the video. Ask any questions about your child health issues and get immediate answers live from a pediatrician. And please share the video. All right, so I think I'm almost done with all my sharing. All right, those who are joining us, let me know you're there. Instagram people, you're welcome. All right, welcome everyone. Let us see your comments. Let's know you're there. And I'm also just going to pin the videos to the rightful places. All right. All right, I can see some of your comments are coming. Oh, MJ watching us from Sierra Leone. Hi, Sierra Leone today. Thank you so much for joining us. Okay, I'm just trying to pin the videos and I'm trying to make sure I put it in all the rightful groups. Yeah, okay, I think I'm done now. All right. So MJ Koruma, thank you so much for joining us from all the way from Sierra Leone. And Radike Bamikefa, thank you so much for joining us. Welcome everyone. I'm Bemisola Boyde. I'm a pediatrician and I'm your anchor for today. So if you have any questions about the health of your children, feel free to pop your questions under the video where you're watching from, especially for those of you watching on Instagram, on YouTube, on Facebook page. For those of you who are watching in our groups, make sure you click on the video or other groups like super parents and other groups. Make sure you click on the video so that you'll be taken to the video section where I can quickly see your I can see your comments. Otherwise, it will be in the group and I may not say it. Apologies for that. But we cannot stream live directly into the group anymore by Facebook standard. So you have to go on our page, click on the video, and then you can drop your question. And then, yeah, so I'm just trying to pin the video in the page and then we are good to go. But if you have any question, you can start to drop your questions now. Feel free to drop your question. We will try and answer them. All right. Okay. 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 I'm not sure why it's not pinning. Okay, it's pinned now. All right, great. Good evening, Honorable Mobolanle Babs. Good evening. All right. Okay, so I think I'm done with all the sharing and all the pinning and all the posting on the various groups. All right, so welcome everyone. It's a pleasure to be here this evening to talk and answer any questions you may have about the health of your children. I am Baby Boy, the pediatrician, and I'm your anchor for this evening. This program is brought to you by Ask the Pediatricians Foundation. We are committed to the health and the welfare of all children globally, but especially in Nigeria and in West Africa, in Sub-Saharan Africa, where a lot of our children have still um, dying from preventable and easily treatable conditions. So that is why it is a pleasure to be here today. So, just basic rules. Feel free to ask any questions that you may have about the health of your children. Please start with the age of your child. Start and give us a little bit of background, and then ask your question. Don't just leave it hanging, so that we are sure what some people sometimes provide. Uh, Information, but they don't actually tell us, especially what they really want us to do with that information. So feel free to make sure you put in what you want me to do with that information. Those on Instagram, I see you. Feel free to drop your questions as well. All right, so I'm going to start now because I can see I have a few questions already. Radhika, good evening. Thanks for all you do. Thank you for joining me. MJ, all the way from Sierra Leone. I'm so excited to have you here today. Um, Thank you for joining us. And Radhika say, please, how will I know if my baby is ready to sit? So babies that are ready to sit will start assuming the sitting position. It's as simple as that. So usually babies start to sit with some support from the age of 5 to 6 months. And you notice that when you carry them, they are, they kind of want to come up in a proper position. They don't just lie down flat like they usually do as a newborn baby. So they start to come up and want to sit. And so you can start at that point, they can sit with some support, which means that you have to sit behind their back or you put like a pillow behind their back. And then by the time they're about 7 to 8 months, they should be able to sit on their own without any form of support. So that is how you know. So some when it comes to developmental milestones, babies do it by themselves. We don't need to force them. We don't need to make them do it. It's a function of brain development. Okay, so as the children brains develop, then they begin to assume those skills or characters. So that's how you know. Honorable Mobolanle Bab, say long time, ma. Long time. It's good to have you. MJ, so what is the normal respiratory rate for a newborn, a neonate? Okay, so neonates have respiratory rate of 40 to 60 cycles per minute. I'm not quite sure whether that information is helpful for you as a mother, unless you're a medical professional. So there's a way we count respiratory rates. I usually would not trust parents to count respiratory rate for their children because most people may not get it correctly, and because sometimes parents count both the in and the out, so we usually count the out, not in and out. So that's the issue as far as respiratory rate. But what I normally would recommend that if as a mom you are worried that your child is breathing fast, it's best to take them to the hospital and we can examine them. We can count the respiratory rate ourselves. Most time you hardly notice children breathing. Most of the time when you are breathing, nobody notices. So that is a very good way. So if you can't even notice that this child is breathing at all, that is a good sign that the respiratory rate is fine. But once you start noticing either the sound or it look as if this child's chest is going in and out very fast, or the child have what we call like some depression around above the clavicle or in between the ribs, what we call intercostal muscles. If you start noticing that there is, things is going on, once you start noticing the breathing of a child, there's something wrong. It's either it's too fast or it's difficult and that time you need to go to the hospital. But if a child is breathing normally, you hardly even notice that the child is breathing. So that, I think, for parents, that is more relevant for you than for you to know rates, and you don't need to memorize things like respiratory rates and all that. That is more for the health professionals. So I hope that is helpful. So for those who are just joining us, you're welcome, and feel free to ask any questions that you may have about the health of your children. We've got 1 hour to answer your questions, but that's not to discourage you that even after we are off the live session, if you still have any questions, feel free to go to our Facebook group, and you can post your questions there, and we will always answer them as soon as we can. Sometimes it takes us up to 48 hours, sometimes 72 hours max, but we try our best to answer your question as soon as we can. All right, MJ, you're welcome. All right, Yakubu Priscilla, what is cause of a child collapsing? Like when the child is probably 3 to 4 months. What do you mean by collapsing? What exactly happened? As much as possible, try and, when you're asking professional questions, try and put it in simple everyday language. Avoid using some things that don't necessarily may not mean the same thing to everybody. So I'm not expecting a 3 to 4 month old baby to collapse. So because if you use the word collapse and want to take it literally, it means somebody fell off on the ground or something like that. But I have a feeling that's not what you are trying to say. So, but it's best to tell us what the child did exactly. Did the child stop breathing? Did the child stop, fainted, or did the child have a convulsion or whatever? It's better to always put things in clear, simple words so that we're sure we are on the same page. Like what you're saying is what I'm understanding, and then we can now provide you appropriate answer. But just to generally say that there are many reasons why a child may become very ill, or the child may stop breathing, or the child may become unconscious. There are so many things that can happen to that. So it is not something I'm just going to guess and say, oh, why did this child become very collapse? I mean, it's a very too generic a question to even answer. It's best to tell us this is what happened, this is what happened, and then we can give you an idea. But actually, the best people to answer that kind of a question is the people that you took the child to. So if a child became very ill all of a sudden, you must have taken them to the hospital, and feel free to always ask questions from the doctors, and then they can tell you, okay, all right, you've provided some extra information. You think is convulsion. Okay, so a child who is convulsing, just to also clarify, we're on the same page. It means the child is stiff and the child is checking their body. That is our own understanding of convulsion. So the conversion can happen with fever or without fever. So whenever a child convulses, please always take notes whether they have fever or they are not having fever. I mean, it's as simple as just touching their body to know whether their body is hot or not. Because a child who is convulsing with fever versus a child who is not convulsing with fever, there are different causes on his own. And then, of course, the child has to have a specific age, because there's only like 3 to 4 months. The child must have an age. So if a child is convulsing with fever, there are many illnesses that can happen with fever. Even the high fever itself, just the fact that the fever is so high can make a child to convulse. So we have what we call febrile convulsion. And that is why when children have fever, we don't want them to have fever for too long. We want to bring down the fever quickly. And the reason why we try to bring down the fever quickly is because when the fever is too high, it can cause convulsion. Usually it tends to happen in children between 6 months to 6 years. And in some families, they have that tendency. It's a familial thing. So in some family, once they have fever, the children will convulse, even when the fever is not too very high. So those kind of people, they really need to be very, I would like call it like very aggressive with bringing down fever. So the fever itself being very high can cause convulsion. Now, what is causing the fever itself? So, for example, infections in the brain or severe malaria that has affected the brain can also cause convulsion on its own. So fever on its own, without even looking at the cause of fever, can cause convulsion. But there are also certain illnesses that can affect the brain, and meningitis, cerebral malaria, and one of the features will be convulsions. Okay, but there are so many other reasons why children can convulse. Children can also convulse without fever, and that could be due to abnormalities in the brain. It could be due to something wrong with the blood levels, maybe the calcium or the sodium is abnormal. It can also manifest with convulsion. Or a child who has a brain tumor, a brain cancer, the first sign you may even see in such children also may be convulsion. So there are so many causes. And sometimes some children who have what we call epilepsy, sometimes we don't have a cause for the fever in those children. So there are many things that can cause convulsion in children. So when a child has convulsion, it is an emergency. It is an emergency. That child has to be taken to the hospital. We already have articles on our website on what do you do and what are the first steps, what do you do when a child is convulsing, and what don't you do? Because in my own experience as a pediatrician, it's as important to tell people what to do as also important to tell them what not to do. I think I will start with talking about what not to do, because a lot of people do the wrong things. Number one, don't put the child's leg in fire. Okay, don't put onions in their mouth or in their nose. Okay, don't put spoon in their mouth. Don't put stick in their mouth. Don't what else do people do? Oh, just tell me what else you do. Don't put salt. Don't put spirits. Don't put only anointing oil. Don't do any of those things. If a child is convulsing, you cannot stop the convulsion. Okay, at home, you cannot stop the conversion. What is most important for you as a first aid is to make sure that that child does not hurt themselves, making sure that they do not hurt themselves in the process of that conversion. So you want to remove any dangerous, because most times children who are convulsing are not aware, so they can drop on the floor, they can hit the head, and that may even be more dangerous than the conversion itself. So you want to remove any dangerous materials around them. You want to make sure there's no tight clothing on the neck, anything that can cause further injuries to them. And then you just leave them alone to stop having the convulsions. That is it. Most of the time, you can time it, like I said, check whether they have fever, and then check your time. When did the convulsion start and when did it stop? How long did it last? Those are the kind of information that the doctors will need from you later. And just make sure you put them on their side, and you will have to stop the conversion on their own. Nothing you can do can stop the conversion. So once they stop having the conversion, most conversion will stop within seconds, but some may not stop up to a minute. But if it is going on for 5 minutes, please call the ambulance, because that child has to be taken to the emergency room. But if the conversion stop within seconds, a minute, you can now take the child to the hospital, and the doctors will investigate and manage the rest of it. If the convulsion is going on for 5 minutes, please call the ambulance. In children who tend to have convulsion a lot, we actually give parents drugs that they can give to them. And most of those drugs are something that they can actually just put under their tongue. It's like something that it will be absorbed without the child drinking it. So when the child is convulsing, don't force them to eat anything. Don't force them to drink anything. So we either put something under their cheek, what we call buccal, like midazolam and all that, or we put something in their anus, something like rectal diazepam, for children that tend to convulse a lot before now. So those are the ones we give those ones. But if it's the first time ever, there's nothing you can do. The convulsion will happen. We have to stop on its own, and then you can now take the child to the hospital. But I think for us in Africa, especially, the most important thing is to what not to do. And I see a lot of people have managed a child before who had febrile convulsion, and the child eventually came to the hospital. But guess what? They've burned the hand in fire and they burned the legs in fire. The child actually stayed months in the hospital treating the burns that was caused by people not from the conversion, that because the child had conversion from malaria, within 2-3 days we finished treating that malaria, but we have to keep the child in the hospital for months in pain, infections, all sorts of complications, including contractions and all that, because ignorant people, decide to put the hands of a child who is convulsing in fire. And that is the main challenge the child now had in the hospital, not even the original malaria that caused the febrile convulsion. So please, let's take note of what not to do in a child who is convulsing. I hope I've gone into details for you, Priscilla. But if you still have more questions, let me know. Okay, I'll go to Instagram. She felt girl say good evening, my 3+. When you are writing the age of your child, please don't write 3+. It doesn't make any meaning to a pediatrician. Is your baby 3 days old? Is your baby 3 weeks old? Is it 3 months old? Is it 3 years old? Always be specific. Unfortunately, we as pediatricians, we manage a wide range of babies. So we marry a wide range of children. So 3 doesn't make any meaning to us. You have to be very specific about the what goes with the 3. I see this happen a lot on our group. People just write the age of their child as a number, and then they want me to decide whether I should make it a 3-day-old or a 3 weeks old or a 3 months old or a 3-year-old. And the answer we're going to give you can vary. So if I'm answering question on jaundice in a 3-day-old, it's not the same answer I'm going to give for a 3-year-old. So it's very important that you always specify. Make it an habit. Okay, thank you for updating it to 3 years, 6 months. And that is more important. Okay, so you're 3 years old, baby is always sucking your body, and it's a sensory seeking. Yes, I think we must have answered that before. How do you make her to stop? So you give her alternatives to suck on. So for children who have sensory processing difficulties, so there are children who are sometimes sensory seeking, and whereas some children are sensory avoidance. So there are two different things. For sensory seeking children, they want some sensation. So they want to bite on certain things, they want to touch people, they want to feel certain things. Whereas children who are sensory avoidant, they don't want to touch anything and all this kind of thing. So what we normally do is to give them alternatives that are safer. So for a child who likes to suck on your body, you can give the child jewelry toys. There are toys that are made for that purpose that the child can chew on, that you can wash and you can sterilize and you can give the child to use instead of. So you see some children, they actually wear it on their neck like a necklace or something, so that whenever they feel that urge, they can bite on it. But more importantly, I think you should know why is this child also sensory seeking, because those kind of behavior don't tend to happen alone. They tend to happen in the context of other neurodevelopmental disorders like autism, dyspraxia, like what we call developmental coordination disorder, and so many other conditions like that. Though there's also sensory processing impairments on its own, which can also stand alone, but most of the time they sometimes happen in the context of other developmental disorders. So I will really, really recommend first that you see a pediatrician, probably a developmental pediatrician who has experience in that. So if they've established that there is no other health issues, then they can refer you to the occupational therapist. They do some sensory seeking kind of support and strategies for parents. But the summary is to either, if you can get them to stop, is difficult. But if you can give them something that is safer and an alternative, that is what we normally give to children who have those kind of sensory difficulties. So occupational therapists, they are your best bet in that scenario. All right, good evening, Blessing, Hisioma. My baby do have congested nose. How old is your baby? 14 weeks old. Okay. After breastfeeding. Okay, I think you must have asked this question before, or maybe you are not the one, or somebody else asked the question. So the child should not have congestion of the nose when they are breastfeeding. And especially when you say at night, then the more you talk about night, then you make me worry that you are the one not breastfeeding the baby properly. Maybe when you are breastfeeding at night, especially if you are breastfeeding lying down, I hope you are not allowing milk to enter inside the nose. Ability to breastfeed lying down is something you must know how to do. If you don't know how to do it, please sit up and breastfeed your baby, because it's very easy when you are sleepy and you are trying to put the breast in the baby's mouth, you may put it in the nose, or a little bit of the nose of the milk may run into the nose. So with some effort, some mothers become very good at breastfeeding lying down. But at the beginning, some mothers struggle with breastfeeding lying down. So if you are not very sure how to do it properly, I would recommend you sit up when you need to breastfeed your baby. Make sure your baby is properly positioned. Make sure that the milk is not going to the nose. Remember, the nose and the mouth are so close together. And I know that as a mom, obviously you'll be tired, you may be feeling sleepy, and you have to breastfeed. So it may be difficult, but please, we don't want the breast milk going into the nose, because that is a very dangerous thing, because the baby can aspirate, and so the food way and the airway, they are just close to each other. So if the food goes into the airway, it can cause a lot of problems. So that congestion is really, especially when you put it at night, I'm worried that maybe you're allowing milk to get into your baby's nose, and you really need to make sure that the baby cannot draw the breast milk into the nose. You are the one that needs to make sure that the breast milk, it goes into the mouth. We've talked about during the breastfeeding week how to position baby for breastfeeding, making sure that the whole of the areola with the nipple is in the mouth. So that way, there is no way the breast milk will be coming out. It will, everything will go into the straight into the mouth of the baby and into the airway. And of course, make sure again that the baby is properly positioned. And if you are not quite sure how to do the breastfeeding lying down, I would strongly recommend you do it sitting up, so you are sure what you are doing. That will be a better option. All right, let's move on. If you still have any clarification on the question, feel free to hit me in future comments. If I'm not, thank you for coming back. I would like if it's to know if it's something to worry about, if my 6 months cannot roll over. No, I will not worry about it. So most of these things we say averagely 5 to 6 months old, but definitely I'm not going to worry about it at 6 months. So if we say something, a child should do it at a particular age, at that particular age, that is not the time we're going to worry. We're going to give the child a little bit of time, because just like every other thing else, just like all of us, we all get to certain things at different time. So if a baby is supposed to roll at 5 to 6 months and maybe it's not rolling at 6 months, I will just give the baby another 2, 3 months and see whether the baby is just a little bit slow catching up, So we won't worry about that. But it is when, for example, I expect the baby to now sit up, sitting without support, and the baby is still not rolling over, then that is when it's going to become a concern to us. So when we say baby should walk averagely at 1 year, I'm not going to worry baby is not walking on their first birthday. I'm still going to give baby another 6 months to catch up. So because some babies walk at 14 months, some walk at 15 months, and we're still not worried about it. So when we say averagely this, it's just average. That means 50% of people will do it at that time, but the rest may not do it at that time. And some people do it at 14, at 16 months. It's still normal. But by the time we get to 18 months, we expect 95% of people to have done it at 18 months. So if 95% of people have done it at 18 months and that baby is not yet still doing it, then we think, oh, the baby is now becoming an outlier, and then we want to now start looking. I hope there's nothing we are missing. Sometimes there's still nothing we are missing. I've seen a lot of babies that is that 18 months we said the baby should come and see us. That is actually the day the baby will now start walking, and the mother will feel like, what is all this? But it's fine, but if by 18 months baby is not yet walking, then that is when the pediatrician will start to think and look whether there's more. So I really want to emphasize that, because I see a lot of parents worry unnecessarily. In fact, you are even good that you are asking us about 6 months, but some others even like babies not crawling has 9 months. Some people will start asking that question at 8 months, like, well, there's no rush. So everybody will get where they are going in their own time. It's only when the gap is so far, that is when we will worry about it as pediatrician. So, and your baby is rolling from back to tummy, but it's just the other way around. So I'm not going to even worry. It's not as if baby is not even rolling at all. So I think you just give her time We don't worry at all about children's developmental milestone. Just give them time. As long as the child is really doing so many other things else. If the child is not doing other things else, that is when we worry. But the child is having their control, the child is rolling already this way but not the other way. That is not something we are going to worry about. Okay, it's the same question. I think you duplicate it. Okay, just give the baby time. Yeah. All right. Okay, then you say you like to know if it is bad to sweeten baby's pap with formula. No, of course not. You can do that. It's okay. It is what we recommend. You can use your baby's formula as your milk for the pap. You can use it as a way to sweeten the pap, so there's no need to add sugar. That is perfectly fine. Okay. Um, I've seen an online on doctor. I don't know why people always listen to the people that are saying the wrong things. I've noticed that people always come to ATP to ask us about something they've had somewhere else. And I'm like, how come you're always hearing the wrong information? You don't come to hear us who are saying the right information. Unfortunately, we live in the era of social media where anybody can set up a live stream. Anybody can see anything online. A lot of nonsense online. And to be honest, there are a lot of nonsense on social media and a lot of things people say that are not wrong. So before I answer your question, my general advice, when people want to give you advice, you need to ask, who is this person giving me advice? Okay. You need to be sure that person has the qualification to give advice. And even when it comes to health issues, it is not everybody that can also advise you on health issues of children when it comes to children issues. So a doctor who is not a pediatrician cannot actually advise you on that. So you really need to be sure that this person really knows what they're saying. So what you're saying, that somebody said that using soya bean powder is wrong, it's not true. I mean, it's not true. And these days, thank God for AI, thank God for internet. You can verify information very quickly. You can verify and you can go to sites that you can trust. So if you go to WHO website, you go to the NHS website, you go to all the standard hospitals. They have their own website, not .com. Don't go to any .com website. Most of the organizations have their website ending in .org, .net. They usually have organization website. So most of the .com are people's own personal website or stuff. So if you go to those kind of websites, go to NHS, UNICEF, WHO, you can verify information. Organization like dietitian, maybe British Association of Dietitians or Nigerian Association of Dietitians or Pediatric Association of Nigeria website. If you go to places like that, you can verify all this information. Okay, or you can even ask AI or ask Google. It will tell you and it will give you references. So you can always cross-check the references. Where is this reference coming from? Is it coming from the World Health Organization? Is it coming from the UNICEF? Is it coming from NHS? Is it coming from American Academy of Pediatrics? So these are places where you will get information that you can stand by. But a random person setting up a broadcast on social media and saying all nonsense, you don't have to go by them. Even if I say something and you're not sure, you can always go and verify it. Yes, we live in the era of what we call evidence-based medicine. People must give you the evidence. And unfortunately, a lot of people say all sorts of nonsense on social media. And unfortunately, I think that for whatever reason, the bad news, the wrong information tends to travel far and wide. In fact, that's why even Facebook sometimes they kind of how would they say, like they veto some information and put some as just to help people, but it's a little bit tricky really. So please don't just fall for any information you hear online. Verify it, make sure that there's authority behind that. And the fact that somebody called themselves a doctor is not an authority, for them to give you an information. Even people that are so popular, so-called so popular doctors on social media, not all the things they say are correct. So it's not all the people that come and make noise that are saying the right things. So you need to, you must, or even for us, if you want to always go verify information that we give to you. But I'm giving you very standard organization website that you can always trust. You can trust what is written on WHO. You can trust what is written on UNICEF. You can trust what is written on NHS. You can trust what is written on AAP. Those are very standard. It's not one doctor. It's not one pediatrician writing on those websites. It is the knowledge of all the specialists coming together. So there's nothing wrong with you using your soya bean powder with your pap and all that. It does not cause any health issues for your baby. If your baby, but remember that if you are using soya bean powder, you don't always have to. If you are using it as your milk, then you don't have to use another formula and all that. Just make sure you make up your mind which one you want to do. And again, let's be mindful of the fact that children should not just be eating only one food. So it's not just soya beans and milk, pap all the time. We should make sure we aim for variety of food. I hope that is helpful. Okay, I still don't have any question on Instagram, so I'll continue with Facebook people. Um, so don't fall for anything you hear on social media. Mary, thank you, Mary, for joining us. Mary is our national um regional director, sorry, our regional director for South Active Pediatricians Foundation. Thank you so much for joining me. Remember that ATP is not just online. We are not just only online, we are also offline. We do a lot of outreaches. So if you want to be part of us or want to support us, please remember to come and join us. Thank you. All right, Shama Max, are there activities that trigger recurrent adenoids after drug treatments? No, activities does not trigger adenoids. And adenoid treatment is actually not drugs, okay? Just where we are still on adenoids. So adenoids are normal tissues. They are normal parts of the body. We call them lymphoid tissue. Basically, what that means is that they produce what we call antibodies to help the body fight infection, and they are around the opening of the airway, opening, around the back of the throats of the babies. So adenoids are normally present. Everybody has got adenoids, okay? But they get bigger. So whenever children have infections, because they are trying to walk to produce those antibodies to help the child to fight infection, they get bigger and they get bigger. And when they get bigger themselves, they can cause obstruction of the airway. Sometimes they themselves can get infected, okay? They can get infected by bacteria. So you can have adenoiditis, and adenoid and tonsils, they go together, they are close by neighbors, so you can have tonsillitis. So they are normally present. So when children, there's nothing like a child having adenoid per se, but a child can have what we call adenoid hypertrophy. None of the adenoids get bigger, but the good news with adenoids is that they get bigger to a certain level, then they start to shrink. So usually by the time they're about 4 to 6 years old, most children, their adenoids would have become so small and no problem. But the challenge we face is during that process where they are getting bigger in the 1-2-year-old children. If it's too big, it can cause that obstruction of the airway. So those are the children that are always snoring, they're always mouth breathing and all that. And of course, it can also get infected. So it is that infection that your doctor will treat with drugs. So they may treat with antibiotics, but some children can still keep on having the infection. So in fact, once a child has had infection 6 times in a year, it's an indication for us to go and just take out the adenoids because it's becoming too much. So if the adenoid is too big and causing obstruction of the airway, some children will actually stop breathing. They have what we call obstructive sleep apnea. In other words, they will suddenly stop breathing at night when they are sleeping, and that will wake them up. Then they will start to breathe again. So, or they are really snoring both daytime, nighttime, and of course they're having infection so many times with high fever. You're always going in and out of hospital with antibiotics. Those are the things that will make the ENT doctors to go and take out the adenoids, because luckily all the things that the adenoids are doing, there are so many other tissues in the body that will do it. But if the adenoid is just big alone, but it's not causing any problem for the baby or anything like that, we don't have to do anything. We will just wait and see whether it's going to shrink on its own by around 4 to 6 years old. So activities does not make the adenoid grow bigger. It grows big on its own, and it can get infected, and that can be the problem. So if your child has enlarged adenoids, and it's causing problem. Some people have enlarged adenoids and it's not causing any problem. But if your child has enlarged adenoids and it is causing problem, you must see your ENT doctors, and your ENT doctors will be the one to decide, do we need to go take out these adenoids? And a lot of children need to have the adenoids taken out. So that is one of the major works that the ENT doctors will do. But it's not something you can control per se. It is what it is really, and we just deal with it. All right. If I might say, what do I expect for my 2-year-old plus academic wise? What are you expecting academic wise? I think a lot of others, we have a lot of how would I call it, like expectation. I don't expect a 2-year-old to do anything academics. I expect a 2-year-old to play. 2-year-old should just play. They should stay at home, play with their mother, play with their friends, eat, sleep, play, not go out do anything academics, please. All right. We don't even expect a 2-year-old to be in school. A 2-year-old should be at home. Okay. A lot of us are allowing our babies to go to school too early. I mean, well, whatever you call school. Anyway, but for us as pediatricians, school is actually from the age of 6 years old. School age 6 years old. Everything before 6 is preschool. Okay, so we expect them to just play and have fun. Just let them relax, let them enjoy. Where are you rushing them to? So there's no academics for a 2-year-old. I'm not expecting them to go and write. All these teachers that are giving babies homework, they are only giving the homework to you, the mother, so not the babies. The children don't need any homework. They don't need nothing. All this one, you were allowing children to go to school from 8 to 4, 2-year-old. For what? They should only go to play for maybe 1 or 2 hours and then come home. That's it. We expect them to just play. That is the only thing we expect a 2-year-old to do. To learn to play, interact, speak. That's all. That's all they need. No other, nothing academics. Academics is from age of 6 years old when they're in school. All right, Joanne say, good evening, Doc. Thank you for this platform. I join every Monday. Oh, that's nice. Thank you for joining us. And I learn new things always. God bless you. Amen. God bless you too. All right. Let's see whether we have any question on Instagram. Instagram people are quiet. No question. Feel free to ask your question. I still have about 18 minutes here. So let me just pick up while we're still waiting for more questions. Let me pick up on the last question that Ifama asked, because it's a question we get a lot also on our group. So for us as pediatricians, we divide children into different age groups. So we have the newborn baby, 0 to 28 days, first month of life. Then we have the infants, again, 1 month to 1 year. Then we have our toddlers, 1 to 3 years, which is where the 2-year-old are. And then we have the preschoolers, and then we have our school age children, 6 to 12. And then we have our teenagers, 13 to 18. We also have what we call the adolescents, 10 to 19 as well. So we have different kind of classification on all that. And for the first 5 years of life, which is the preschool years before school age, we focus on the development of the children. That is what is paramount. That is what is important. It is not the writing or no, those are not the focus at that point. At that point is the development of the child that we're interested in. We're interested in the child's different area of development. We're interested in their gross motor skills. We want them to be able to walk, to jump, to run. That is gross motor. Play football, ride a bike. Those are the things we should focus on at that age. Fine motor skills is the use of the hands, not necessarily writing notes or anything, but for them to use their hands. So usually children use both hands up to the age of 18 months, 2 years. By 2 years, they develop what we call handedness. So they can be right-handed or left-handed, and there's nothing wrong with either of it. So don't force the children to be right-handed. I know it's a cultural thing for us in Africa, but a child can be right-handed or left-handed. It's from their brain. So if your child is dominant left brain, they'll be right-handed. If they are dominant right brain, they'll be left-handed. So we expect them to play, build blocks and all that. So those are the kind of toys you should be buying for your children, not to be let us not use screen to babysit the children. Let's not be allowing them to watch cartoon from morning to night. Let them play, let them go out, let them run around, let them play, okay, and let them play with other children. This is the time they learn to do what we call cooperative play, playing together with other children. That's where they begin to do all this imaginative play. They begin to role play as a doctor, or they role play as a teacher, or they role play as daddy and mommy. I mean, most of us remember that. That is what we expect for that age group. We're not expecting them to be sitting in any classroom, have to be doing any homework. We expect them to just play. Okay, of course we will expect their language to develop at that time. And children can learn multiple language at the same time. So if you are Igbo, your husband is Yoruba, you are living, they are going to English speaking nursery, they can learn all three languages at the same time, because their brain is so plastic. So you can expose them to all those kind of multiple languages. These are the time we expect to focus on potty training them. Mostly by 3 years they should be out of nappies and all that. So those are the things we expect in that age group. Toys to develop their skills, their developmental skills, not unnecessary pressure or going to school. They should sleep, they should have naps. That is the focus at the first 5 years of life. Their brain is still maturing. So we want them to, so they have the genetic composition to develop, and then you now give them what we call the nurture. So it's a nature nurture thing. Nature is what they inherited from you. So if you are very brilliant, especially for the mothers, your children are going to be brilliant because they're going to get the genetic things from you. But notwithstanding, you have to nurture. You have to give them the right food for their brain to develop. You have to give them the right environment, the toys, the stimulation for them to develop. So those are the things that we need to provide for our children around that age. And then by the time they're about 5, then they are ready to go to school. And then that is where what we call cognitive, the learning, formal learning, let me put it that way, because every other thing else is also learning as well, but that's when formal learning starts. Okay, Blessing saying, is there any medication for the, no, there's no medication for the congested nose. We've told you what is causing the congestion. What you need to do is to stop what is causing the congestion. Okay, stop breastfeeding baby lying down. Let baby sit up to breastfeed. Make sure breast milk is so once you do that, then the congestion will stop and the baby will not need any medication. Not everything in medicine is medication. Even for those of us in pediatrics, everything is not medication. Some things don't have medication. Some things just need us to do the right thing or to stop what we're doing. It's just the same thing for like allergy, for example. If a child is reacting to something, the solution is to stop the exposure to what the child is reacting to. Unless the allergy is really bad, then we can give you something to stop the itching and all that. But the solution is just to avoid the trigger, if I can put it that way. And it's the same principle we use all the time. All right, Chama. It's saying my 5-month-old keep having recurrent catarrh, noisy breathing majorly at night since 3 months without fever. Okay, are you the one that asked about the adenoid question? Let me go back here. You are the one. Okay. And without fever and pediatrician tag this, did your baby had an x-ray? It could be adenoid, but at least I would expect that the pediatrician should confirm it by doing what we call a postnasal x-ray, neck x-ray, so they will see the adenoids. So there are ways to confirm if that has adenoids. We can confirm it, and then we can refer you to the ENT doctors. So those are the people that will manage it. All right. So it's but the first thing is to just confirm that it is adenoids, and the ENT doctors need to look at how big it is. Is it really cause for a 3-5 months old? That is really pretty early, really. So I would really want to exercise caution and make sure that we are sure and we're not jumping to conclusion about the adenoids. But your pediatrician could be right. So, but most people will not operate a 5-month-old anyway, but we need to be sure that's what it is. And then if it's really bad, then the ENT doctors need to be involved as well. But there are other causes of noisy breathing. There are other causes of recurrent respiratory infections, so it's has to be confirmed. So there are many other reasons why your baby could be having all those symptoms without having adenoids. So that could even have allergic rhinitis. It doesn't always have to be adenoid. It could be something you're exposing the baby to at home, especially because it said at night. Are you flitting your house? Are you using certain, like some people use all these mosquito coils or some things like that at night? Or some people use generator around their house, and the fumes alone can make baby hair which be irritated, and they can cause exactly the same symptoms. So I would really want to be sure that we're dealing with the right thing. So before I even jump to the night, I want to make sure you are not doing anything at night that is irritating your child's airway first. Then we can now talk about, do other things like x-rays and all that. And the ENT doctors can be involved as well, especially if it's so recurrent, like you put it. All right, I got like 10 minutes more, and if you are in the group, make sure that you click on the video, because otherwise I won't see your question. But let me just jump to the group and make sure. Um, uh, Let me make sure that people are not dropping questions in the group, but you have to click on the video for us to see. Okay, I don't think anybody is dropping question in the group. At least I would only check on the um I've only checked on um Ask the Pediatrician group. I can't really check other groups now. Um okay. But if you have questions after we are off live, please feel free to go to our Facebook group. You can post your questions there Mondays to Saturdays, and we'll try and answer your question. At least we try our best to make sure that whatever answer you're getting from us is something that you can verify and confirm that is true. Is it possible for twins of different sex to share one placenta? It is not possible. Okay, that is not physiologically possible. Okay, so I don't know whether I should go into all the embryology and all that, but basically, so twins can be what we call monozygotic, or they could be dizygotic. So what that means is that if it is one egg and one sperm mixing together, then it will now break into two, and you have two separate babies. Those babies will be completely identical twins, and they will share one placenta. Okay, so that is what we call monozygotic twins. So they actually started as one, but develop into two people. And you always notice that they are difficult to separate. You always not recognize them from each other. But you can have what we call dizygotic twins. In other words, there were two eggs that were released in the first place, and there were two sperms that fertilized the two eggs. So they are just sharing. They're actually brothers and sister, or sisters and sister, or brother and brother, because you could also be the same gender. Okay, even for the dizygotic twin, but they will not always look alike. They will look like brother and sister, or sister and sister, or brother and brother, but they will not be identical, completely identical, like the monozygotic twin. So for those ones, they are two separate human beings, two separate placenta, two separate everything, sharing the womb. That is what they're sharing. There's nothing else. They are just happening at the same time. So now that. So Emily Love says ciprofloxacin syrup good for children. There is no drug that is good for children. So drug is not something. There's a way you ask that question that is, it just rub off wrongly on me. There's no drug that is good for any child. We don't want children taking drugs except it's absolutely needed to give to them. So drugs are meant to be used for specific situation. So when you say something is good, it gives implication. I know that's not what you meant, but that is the way it sounds, as if this is something, okay, you can go and be buying it for your children because it is a good thing. No, there is absolutely no drug that is good. Even your multivitamins, we don't want children taking drugs at all. We don't want children on any drugs. We want children to eat their food. We want them to develop without any drug, because for your information, drugs are not just what you think you heard. So if you say you're buying vitamin C, for example, it's not only the vitamin C your child is taking. There are several other things that have been added to that vitamin C to make it stay and have a shelf life, so that it will last for 2 years, so that it will stay in the cupboard for 2 years. There are many things that have been added to it. We call them excipients, and there are lots of controls over those excipients, but you don't even know a lot about that. And there are a lot of fraudulent people that will not do the right thing and will put the wrong things as well, especially if you live in countries where there are no strict regulations of this thing. So the best thing is to give your children their food, even their vitamins. Let them eat it. Let them eat their fruits. Let them eat their vegetables to get the vitamins. Don't rely on giving children drugs. So drugs are poisons. They are no good at all. Of course, but we sometimes need to give drugs for children who are sick. So if a child has infection and a doctor decided that, okay, maybe based on the culture result, the sensitivity result, this is a drug that should work for this charm, then yes, we will give the drug. But that is something we don't want to be good. So drug generally not good for children, and definitely not antibiotics at all. So I hope that is very clear. And please, mothers, stop going to buy antibiotics for your children. A lot of us do this wrong thing. A lot of time people will ask questions. My baby has watery stool, diarrhea, and I've given flagyl, and they're thinking it's something nice to say. It is wrong. Don't give flagyl to children. Some people even give them, oh, because we're going to party, you've eaten a lot of cake, you've eaten a lot of this. Let me just give you flagyl. No, as if this is the replacement for agbojedi that we're giving those days. No, don't give your children flagyl. It's an antibiotic. It has side effects. It has other reasons. And use of antibiotics when it's not meant to be used also creates a lot of problems for us in the future when the child now needs the antibiotics, because the child may not be resistant and the antibiotics is not going to work. So please avoid using antibiotics. Use drugs only when a doctor has written it for the child for a particular reason, okay? Otherwise, please and please don't use drugs for children that has not been prescribed by a pediatrician. So is it necessary for a 4-month-old baby to bath every day, even in cold weather? It is not compulsory for children to bath every day. You don't always have to bath every day, but you have to make sure the child is clean. You can just wipe them off if you're worried about. In places where they have very cold weather, they don't always bath their children every day, maybe every 2-3 days. There's nothing wrong, but it doesn't mean that they keep the baby dirty. It just means that they can just put a face towel in lukewarm water and wipe the baby, and that is it. But I know what you meant by bath is that you strip the baby off completely and you pour water on their head, pour water all over them. It's not compulsory to do that every day. So that is that, especially if you live in an area where it's cold. Yeah, I've answered the same question. You asked it twice. Was that the adenoid tonsillitis the rise? How can the expecting mothers prevent it? There's nothing you can do to prevent it. I don't know whether you were listening when we talk about adenoids and tonsils. I've already talked about it, that they are parts and parcel of your body. Every baby has adenoid and tonsils, so there's nothing you can do about them. They are there in the body, and they're there for good reasons as well. But it's only if they get infected and they get bigger that it can cause a problems. Otherwise, there's nothing. So it's not. I get a lot of questions of mothers saying, "Oh, how can I prevent this in my child? How can I prevent that?" It's not everything that you can prevent. People ask a lot of questions. How do I prevent my child from having autism? How do I prevent my child from having jaundice? How do I so there are many things you cannot prevent in the babies that is yet to be born. You can't. So you can't prevent autism. You can't prevent adenoid and tonsils and all that. You can't. So there are some things that are also genetic. As long as you have that genetic tendency, your children can have it. So you can't prevent it per se in a way. So it is not everything we can prevent. But what normally happens is that if something is happening, the earlier you come to the hospital, the better. Then we can deal with it. But preventing it is not. It's not a actually. A lot of pregnant mothers ask me that question a lot. Like, if you have your way, you will prevent the child from having any health issues forever. But I wish we have that magic power to really do that. But the truth is that it's not possible. Okay, as long as that child is going to be born and that child is going to live in this world, you can't always keep them away from everything possible. And when you say the cases on the rise, I'm not quite sure I agree with you. Maybe you are hearing more about it, or maybe people are more aware of it, because sometimes, especially in our culture where everything is malaria and typhoid before, but now maybe because people are going to the hospital and they are now realizing that everything is not malaria and typhoid and all that, maybe. But technically speaking, I will not say it's really rising more than the usual. They've always been with us anyway. So that's that. Okay, seems like today is rather noise and tonsillitis. Can they cause bad breath? Of course, yes, they can cause bad breath, because which is why we tell you that when children have bad breath, don't always assume it's because they've not brushed their teeth. There's so many reasons why children can have what we call halitosis or bad breath or mouth odor, like other people call it, and all that. So, which is why some of those times we say you have to go to the doctor, because the doctor will look into the throat. So, if there's infection around the adenoid and the tonsils, there with a pus on them, they're going to smell, of course. So, children are going to have bad smell, bad breath, or mouth odor from that. Yes, they can. Um, Okay, you said the prophylaxis was prescribed by a doctor, but I read about tendon and nerve damage. Okay, yeah. So that is the second part of the answer to your question, which is why I talked about the fact that you should never use drugs without a doctor prescription. Now, the second part is does not mean that you should not be scared of using drug at all when it is recommended. And if you read about paracetamol side effect, you will also not use paracetamol. Okay, because paracetamol can also cause liver damage, can cause liver failure, can cause all sorts of things. So, which is why I was emphatic about my first part of the message. Every drug is a poison. That is it. Every drug has, what to remember, that is that every drug has side effects, even your vitamin C, even your paracetamol. So they all have side effects. There is no hygiene drug that doesn't have any side effect. Every drug has side effects. Okay. So what doctors do when we prescribe you drugs is that's why it's important that a doctor prescribe drugs. So number one, we're going to give you the right dose. We have to make sure, because it's the dose that will differentiate whether you are using the drug for what we call therapeutic use, for a good thing, or you are using it for something that can cause harm, that a poison, basically. So what of things we do is to make sure that we give you the drugs and give you just the minimum quantity that will do the job. Okay. And of course, we have to monitor for those side effects as well, which is why it is a doctor that should prescribe all those drugs for you. All right. And we should also tell you about all the side effects. So, and when we have side effects, we always rate it. We say, okay, maybe 1 in 10 people, 1 in 100 people. There are side effects that will be 1 in 1,000 people, because every time somebody uses a drug and they complain of something, only because of that drug, it goes into the list of the side effects of that drug. Before drugs are released to market for us to prescribe for you, there's what we call clinical trials. Before we try the drugs in mice, in rats, in guinea pigs, then before we try it in human being, we try it first in healthy human beings, and we monitor them before we try it in sick people, before it is available. So there are lots of research that go into drugs before it gets to the market, before we can even actually take it. So we are aware of all those possible side effects. And so what doctors need to do is to make sure, if we don't treat that child, benefit versus risk, that is what we do. It's a gamble all the time. So if you leave your child without giving antibiotics, what's going to happen? But if you treat your child with antibiotics, well, this side effect can happen. Which one is worse? So if you can leave your child and nothing will happen, then we may not even treat the child, because we don't want the child to have those side effects. But if we know that if we don't treat your child because we are scared of the side effects, then something terrible may happen to the child. Then doctor will say, okay, I'm going to give you the child the drugs, and then I'll watch out for the side effects. So that is what doctors do all the time, which is why a doctor must be the one to write the drug, which is why doctor will ask you certain questions, because we know that some people will react to certain drugs, and we always have to have your child reacted to this drug before. Those are the kind of things that will go. And then if your child has other medical condition like kidney problems and all that, the amount we're going to give your child may be different to the amount we give to another child that does not have those other problems. So there are lots of complexities when it comes to prescription. That's why when I tell people we don't prescribe drugs on ATP, people sometimes get offended and like, Oh, but you're already a doctor and you know what is wrong. Why can't you just tell me the drug to go and use? Because there is more to drugs than something I can do for you online. There are lots of questions I need to ask. There are certain things I need to be sure before, because every time we're giving you drugs, we are conscious of the risk of those side effects. So some of the things you mentioned about ciprofloxacin, they are, yes, they are real side effects, but they are not common side effects. They are mostly rare side effects. So rare side effects is very, as the name suggests, will be rare. So in other words, if you give 1,000, 1,000,000 people, maybe only one person will have that side effect. Of course, we always don't know who is that one person that we have the side effects. So this is a trick, but we should at least tell you. And I'm happy you are reading the leaflets, which is very good, because a lot of us don't read the leaflets. A lot of mothers, we just give the drugs. In fact, a lot of people will come and now ask us questions after they've given the drugs. Then they will now go and read the leaflet. I'm like, why are you in a hurry to give drugs? Unless the child is dying, there's no emergency in giving drugs. Take your time, read the leaflets, check all the side effects, and decide. Ask questions, ask us, ask your doctors the questions, and then we can reassure you that, okay, some drugs we still have to give. For example, if you give your child amoxil, your child can have watery stomach, can have diarrhea. But that does not mean I'm not going to give the amoxil. I will tell you I'm going to give the amoxil because the infection, the pneumonia or the urinary tract infection can kill the child compared to the diarrhea. So I will tell you I'm going to give the amoxil, but your child can have diarrhea. So if your child has diarrhea, give ORS. So I will manage the side effects, but I will still have to treat the child. So it is weighing the risk versus the benefit. It's just the same thing we do with pregnant mothers. Sometimes we want to say, if we don't treat you, the mother, your baby, you may not survive, and then there'll be no baby anyway. But if we treat you as well, are we putting your baby at risk? So we have to weigh the balance. And like, sometimes we now say the benefit of treating the mother is far better than losing the baby. So this benefit versus risk. That is what we do all the time. So that is why it's important that the doctor who is treating you take responsibility for that, which is why we cannot prescribe drugs for you online, because I'm not your personal doctor to take that responsibility. You have to pay me my consultation fee for me to take that personal responsibility out of. Now that's just a joke, but it's about all this conversation around the risks and counseling the person adequately, making sure I have all the enough background health knowledge about that person. I've seen a child say was given what's it called? Those days that we used to give Phenergan injection, chloroquine and Phenergan injection. Very healthy looking girl, walk into the emergency room, walk into the clinic herself, and they just gave Phenergan injection. That child dropped and died straight away. That is how terrible drugs can be. That child died straight away. So these are risks that we need to know when we're giving drugs, which is why we cannot just give drugs anyhow. So I hope I've been able to expatiate on that. But if your doctor has recommended the drugs for you, then the doctor will take responsibility for the possible risk that is involved. And you also are taking responsibility, because they will tell you you are aware. You say, yes, I agree. So it's our joint decision. Okay, final question from Bin Tochi. My baby's belly button is very big. We call it umbilical hernia. Yeah, your baby has umbilical hernia. She's almost 4 months, 4 days, 4 weeks, 4 years. So you have to be very specific. Okay. Now, this is an example of a question where the age of the baby really matters to us. Okay, because you have not told us which 4 your baby is. Okay, the advice I'm going to give for a 4-year-old with a big belly button may not be the advice I'll give to a 4-week-day-old or a 4 weeks-old or a 4-month-old. So always be very specific when you're putting the age of your child. 4 years. Okay, thank you. So usually in Africa, by the age of, the maximum we'll give is 5 years. So if your baby at 4 years still has a very big belly button, according to you, very big, but it would be nice to see it and measure it. But if it is very big, like you say, the chances that it's going to become smaller or close on its own is going to be very minimal. But usually most surgeons will say, let's wait until baby is 5 years. But you see, the way we look at it is that for your 4-year-old, we expect it to be getting smaller. So it should have been bigger when your baby was like 1-year-old. Now the baby is getting closer to 4-year-old. If it's going to go on its own, it should be smaller by now. It should be smaller at 4 years than it was at 3 years, smaller than it was at 1 year. So I don't know whether that is your scenario. But if you are still using the qualification is very big at 4 years old, my assumption, I've not seen a child, but my assumption, going by what you said, is that it's very unlikely it's going to close on its own. Now, it now boils down to you. Are you worried about it for cosmetic? Because you say it's not giving the child any disturbance. So is this something you're worried about for cosmetic reasons? Like people will make fun of the child when she's about playing with her friends, or not. So you don't have to decide. If you're worried about it for cosmetic reason, it's big, you're worried the child could be made fun of, then you have to go for surgery. It's a very simple surgery. Basically, they're going to close the hole. So, but if you are not worried about it and the child is not, there I've seen adults that have big belly buttons and it doesn't bother them, yeah, you can leave it. So, but from what you're saying that it's very big, it's not reducing, it means it's been very big right from the beginning. And it's those very big ones we normally recommend surgery, because usually when I see like a three, if you say your baby is 4 months old, I will assume that let's see whether as baby gets bigger, it gets smaller, and that may be, and most babies it will get smaller, and by the time they're about 1 year, 2 years, you can't even see it anymore. The surgeon will give you maximum 5 years. You won't see it anymore. But if it is still very big at 4 and it has not been reducing, it's likely not going to reduce. So I would recommend, from a professional point of view, that you see a pediatric surgeon and they can operate it, reduce it, and close the hole. Because what is happening that there's a hole there that is allowing things to come out, and that is that hernia that you're saying. So we can do a surgery. It's not a big surgery. It's a day surgery. You go there in the day, you come back home the same day. So, but if you, some people say, I don't want to go to surgery. I'm happy with it. It's not bothering me, then you can leave it alone. So I'll leave it up to you, because like you said, it's not causing the child any harm. Now, some babies, it's causing abdominal pain, it's causing obstruction and all that. Those ones, they have to do the surgery. It's compulsory. But if it's not causing any harm, then it's about, is it cosmetic? Are you worried about bullying and all that? Then you can do the surgery. All right, my time is up. Thank you so much. I have a lovely time today. So many questions, variety of questions, so many people, Instagram, Facebook. Thank you. If you still have any questions, feel free to go to Ask the Pediatrician Facebook group. We're there Mondays to Saturdays. Ask your questions. We will help you answer you. A lot of people say, oh, why are you always sending us to go to the hospital? We cannot treat everything online, okay? And some of the questions people ask that we tell you to go to the hospital, we would have expected you to know that. But I've started not making their assumptions. Some people genuinely do not know that this is something that's an hospital case. The kind of question we should be answering on ATP are like knowledge questions. Should I do this? Things that are not based on a child who is sick. They are health question, like somebody is asking, can I bath my baby 2 times? Can I bath my baby during cold weather? Hey, those kind of questions, those are the kind of questions we're expecting. But when children are already sick, we expect you to take them to the hospital. But people will say ask us, so we always have to tell you. And sometimes the best advice at that time is to take the child to the hospital. And I'm grateful for those of you who always come back and tell us that, thank you for telling me to take my child to the hospital, because when you go to the hospital, it was something else different from what you were thinking. And luckily, because you went on our advice, you were able to manage your baby properly and the child is fine. So I'm happy for those who come back to give us that feedback, even though some people get upset about it. And so please understand the limitations of social media and online. We're only here for health education, information. We cannot treat your child on Facebook. I cannot set a line. I cannot take a blood sample. I cannot even examine the child. So you always have to come to see us in the hospital for things that require hospital. But general health education, information, we are always there for you 24/6. Sunday we may not be available, but feel free to go to our website, go to our podcast, go to our YouTube channel. You will learn a lot, and we are your partner in making sure that our children are healthy and that our children do not die from preventable causes. So thank you so much. I'll see you again next week, Monday, God willing. Till then, have a wonderful evening, and it is bye-bye from me. Bye.